Our brains are made mostly of fat, so why not nourish them with the highest quality omega-3s available? Omega-3 Rejuvenate from Big Bold Health. Omega-3 Rejuvenate is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. This is not the story of other brands. The fact is, most of the world's fish oil products are produced from several types of species packed into nets in commercial fishing zones, loaded into the holds of vessels that stay out for days or even weeks, and put in processing plants that treat them with high heat, chemicals, and synthetic nutrients. Big Bold Health does it differently. All of it straight from the sea into the hands of skilled fishermen, instantly flash frozen and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique low-temperature extraction preserves the natural goodness of the fish so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman for 20% off site-wide. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. We're talking about chronic pain, and we're talking about an innovative approach to chronic pain that is not so much physical medicine. You know, we have many modalities at our disposal. We can give people all kinds of drugs. There are many categories of drugs that address pain, but often only incompletely, and often with the downside that people become hooked on medications that are addictive. Also, some of the medications tend to dull the senses. People feel brain fog and experience cognitive problems while these medications. It's a big problem, and literally thousands and thousands of people are dying in America. It's actually thought to be one of the big causes for our reversal in estimated lifespan. You know, we thought that we were just going to march through the decades, increasing lifespan, until we all become centenarians. Well, Americans' average lifespan is actually declining, and it's in part due to opioid addiction and deaths of despair, often linked to chronic pain. So this is a very, very important subject. And who among us doesn't suffer from some form of pain? Dr. David Clarke, our guest, is president of the Psychophysiological Disorders Association, the PPDA. And you can find out more at endchronicpain.org. They've got a self-assessment questionnaire to see if there's a component to your pain which is PPD related. So, Dr. Clarke, it seems to me that a lot of patients with chronic pain may be going on kind of like a wild goose chase. So they go from specialist to specialist. They try all kinds of different remedies, both conventional remedies, and then they look to the alternative world for remedies for their pain, using all kinds of different modalities. And is it possible that simply reinforces a cycle of pain? That pain is almost kind of a rut in the brain circuitry or a learned behavior?
Yeah, I think that's true. When you are focusing on the pain, you are using circuits in your brain that are actually physically different than the circuits in the brains of people that don't have these conditions. There are a number of functional magnetic resonance imaging studies now that show that people with conditions like fibromyalgia or irritable bowel or similar conditions, somatization disorder is another one, actually have different brain circuits than people that don't have these conditions. And the more you're focusing just on your physical symptoms, the more you're reinforcing those circuits. But we now have a randomized controlled trial called the Boulder Back Pain Study that used psychological techniques, what I call pain relief psychology, to treat people who had back pain for an average of 10 years. And they only got a month of treatment, 2 sessions a week for 4 weeks. and their pain scores dropped from an average of 4 down to an average of 1 just in that short space of time. And they did functional MRIs on the brains of those subjects and found that they physically changed in response to the psychotherapy. So we're seeing real anatomic differences when the new treatment techniques are applied. And I should also add that benefit that they got in their pain scores was sustained for 11 months. They didn't get any more psychotherapy treatment, but the pain scores stayed down for the full 11 months after that of the study.
And I think that that's important because this is an unseen causation for chronic pain, at least from the standpoint of structure, because, you as a gastroenterologist, if somebody is experiencing GI pain, you might do a colonoscopy or sigmoidoscopy and find that they have ulcerations in the walls of their large intestine, and that's the culprit lesion that needs to be healed. Or maybe a blood test might reveal a high level of C-reactive protein, which indicates inflammation. But without these traditional markers, we need new ways of looking at that. So what's the biological plausibility for this theory? Because there are different parts of the nervous system that may be responsible. The amygdala, which is kind of the primitive brain, the fear center of the brain. There's the autonomic nervous system. How do they figure into this?
Yeah, that's what these fMRI studies are beginning to show, is that the circuits that connect these different parts of the brain are different in people that are suffering from these conditions. They're also different in people who went through adverse childhood experiences as well. So there's a real physiologic cause for this, which reemphasizes the point that these symptoms are real. They're not just in people's heads, they're in their brain. There's real changes there. But the good news is that we have treatment techniques now that several different closely related types of pain relief psychology. And what they have in common is they are going for relief of the symptom, unlike cognitive behavioral therapy, which essentially is trying to help you live with your condition. Mm-hmm. The new pain relief psychology is trying to alleviate it. And it's doing that by going after the stress-related personality traits that often develop out of an ACEs experience in the past. They're looking at the any triggers that are going on in your life at the moment. They're making sure that you don't have an undiagnosed mental health condition like depression, anxiety, or post-traumatic stress. Very simply, the first thing that I do in evaluating a patient is looking for stress in your life at the moment. Is there something that's going on right now that is chronologically linked to the pattern of your symptoms? And all of these things, when we uncover them, we can almost always address them successfully. And then people see that their physical symptoms begin to respond to that. And that gives everybody confidence that we're on the right track. The utilization of healthcare, whether it's alternative or whether it's Western-based medicine, starts to go down because people can see that they're on the right path to healing.
And this is a non-pharmacological approach. I mean, traditionally, psychiatrists and regular doctors will sometimes treat pain syndromes with medication. They say, well, okay, let's acknowledge that there's a psychosomatic component. We'll just give an antidepressant. We'll give something that works on nerve pain like Lyrica. Do you invoke an all of the above approach, or are you discouraging dependency on drugs?
I don't object to using medications when they're indicated. If somebody is suffering from severe depression and we discuss the pros and cons of medication for that, some people will say, no, I don't want to use that. Other people will say, yes, I'm really at the end of my rope and I'd like to have something to give me support while I'm going through the pain relief psychology process. And I'm okay with that either way. I look at the medications as kind of a crutch. We are not using that as our main modality of treating the patient. We need to go after the stresses, uncover them, begin treating them. But if a patient needs the crutch of a medication for 6, 9 months while they're going through the psychology process, I have no objection to that at all.
There's some work being done with ketamine or things like MDMA or even psychedelics like psilocybin, which kind of designed to create a window of opportunity for brain plasticity to kind of allow the brain circuitry to be more malleable. Is that something that you acknowledge can be of help, or is your work completely around non-drug modalities?
Well, we're using the pain relief psychology to make those neuroplastic changes, change the circuits in the brain. But
Mm-hmm.
the medications that you mentioned, they do seem to have the ability of facilitating neuroplastic change. And just working in this field and encountering patients, I do have some anecdotal reports that have been given to me of people getting a lot of benefit from these. That's not the same as a randomized controlled trial.
Mm-hmm.
Obviously, we've got several randomized controlled trials of pain relief psychology now, not only from Boulder, but also from Harvard and the West Los Angeles VA, and from a study in Detroit. And there are more that are ongoing right now, and they're very successful. So the evidence for things like ketamine and MDMA and psilocybin is nowhere near that
Mm-hmm.
level. We don't know about the risks and benefits. We don't
Right.
know
And it may,
exactly the right kind of patient that should be chosen for this. But there's definitely reason to pursue further work on them. I'm supportive of more research with those.
and the popularization of these things may lead people to do a DIY approach with access to medications that may not be warranted or under unsupervised conditions where people might expose themselves to risk, right?
Yeah, as you know, the history of medicine is full of pharmaceuticals that looked extremely promising in their early trials, and then when subjected to the gold standard of a randomized controlled trial, they didn't turn out to be quite so promising. So I'm um, basically holding off on final judgment around those. I think the day will come when we are able to identify a certain subset of patients for whom these are appropriate. But I'm waiting to see what that's going to be.
Mm-hmm. Well, okay, this is so promising and so relatively inexpensive. It would seem that this is something that should be embraced by the medical establishment. I'm thinking of the vast VA hospital system where, in part, I trained and where the majority of patients were suffering from pain syndromes. And the amount of money and the amount of disability that pain is causing, especially ex-military personnel, would warrant embracing this approach. Are you making any inroads in having them integrate these techniques in their pain programs?
Yes, it's really starting to happen. People that become aware of this and learn about this and begin using it in their personal practices. Once you see these sources of stress in your patients, you can't unsee it. And you are turning a population that in the past would make primary care doctors beat their heads against the wall, and all of a sudden they become very rewarding to work with. You see people who have been ill for years sometimes getting better. One of my patients, just talking about the cost here, he had been ill for 55 years. I saw him back in the days of paper charts, and volume 3 of his paper chart was 3 inches thick. Full of negative diagnostic tests and unsuccessful treatment trials. And by using this approach, uncovering the stress that he had, which in his case was physical abuse as a boy, and he was 74 years old and it was still making his stomach hurt. He was cured in 30 days. I sent him to a support group slash class that I had available at that time. And he just met with that small group and shared his story and got a lot of support from those people. And that was all it needed. He was cured in less than 30 days. So people who are working in healthcare systems that are at financial risk for doing a poor job with this population, they are seeing the benefits of this both therapeutically and from a cost standpoint, and starting to use it. One group that I taught started with 3 doctors, and 3 years later, there are now 70 doctors all using these techniques in that community. You mentioned the VA. There was a randomized trial at the West Los Angeles VA of older male veterans, mostly men, averaging 73 years of age. Very tough group. I mean, you are not going to get anywhere if you throw psychobabble at people like that. They got 42% of them to achieve their pain relief goal, compared to only 5% that achieved the goal with cognitive behavioral therapy. They were using the way they got the 42% better was using pain relief psychology. So it's the tipping point is coming. Let's put it that way.
Okay, folks, at this point, let's pause and allow one of our sponsors this opportunity to share an important message with you. So please listen up. Here goes.
Are you concerned about your blood pressure? Join the millions worldwide who have chosen Kyolic as a natural alternative to support their heart health. Why Kyolic? It works. Over 900 published scientific articles and research studies have shown that Kyolic aged garlic extract has a positive effect on cardiovascular risk factors such as high blood pressure, cholesterol, circulation, blood sugar balance, and more. Kyolic aged garlic extract, organically grown garlic aged for up to 20 months for maximum purity and potency. Gentle on the stomach, easy to swallow capsules with no offensive garlic odor or taste. Visit Kyolic.com. That's KYOLIC.com. Learn about Kyolic Formula 109 for blood pressure, as well as Kyolic's other cardiovascular formulas. Kyolic is sold at Sprouts, Natural Grocers, Whole Foods, and natural health stores everywhere. Also online. Get Kyolic Blood Pressure Health Formula 109. It works.
Thanks for listening. Thanks for supporting our sponsors. They are what make outstanding broadcasts like this possible on Intelligent Medicine. And now back to today's guest, Dr. David Clarke. So a practical question is, how do you overcome patients' resistance to the notion that their pain may not be, in quotation marks, real? Because some patients may be very guarded about this. They may say, Doc, are you suggesting that my complaints aren't legitimate, that I don't have a bad back, that I don't have some serious wiring problem in my intestines, that, on and on it goes. They've been given sort of a mechanistic model for their pain, and they may cling to it. And that there's a sort of a stigma attached to the notion that somehow the brain is involved in mediating pain signals. As neutral as we are about that, because, we're looking for practical solutions. We don't really care about, the stigma or the values associated with one or another style of treatment. Patients may resist that. Do you encounter that, and how do you overcome it?
Yeah, it's the number one question I get from my physician audiences is, how do I mention this possibility without the patient throwing me out of the room? Right. And it's important to point out that symptoms generated by the brain are every bit as real as symptoms from any other cause. And, I'll mention the patients that I've had who've been in the hospital and the one who was getting morphine around the clock. These are, it is astounding. And I had to go through that process myself when I first found out about this. It was hard to believe that your brain could produce symptoms at this level of severity. And I say that to patients. I say, when I first heard about this, I didn't believe it either. But, after 40 years and 7,000 patients, I'm, absolutely a believer. And what's good about this is that there's hope that, people, like I say, who've been ill for years or even decades can get better. And when people hear that, they are willing to, travel with me down that road, do a stress evaluation, begin some of the treatment measures, and see if there's a response to it. And it's when people start to get better that they become convinced. And one of the lines that a colleague told me about is a patient of his said, do you mean that this pain is not in my head, it's in my brain? And my colleague said, absolutely. And that made a huge difference to that patient.
It's like a reframing of the whole situation. Yeah,
Completely.
what I do sometimes with patients, when I'm trying to encourage them to embrace the new modalities, I say, look, in your quest to get well, it's like walking down a corridor where there are a lot of doors. And in your quest to get well, you need to open a lot of doors. And some doors may yield a fruitful solution, create progress. Other doors may be not worthwhile, but you got to open those doors. And someone who's subject to a lifetime of chronic pain surely would be motivated to open some doors, whether or not they're going to get a full resolution or a successful outcome. Well, that may depend on the circumstances, but it's certainly worth opening those doors. And I would encourage my patients to examine this option.
Yeah, another idea that helps people is when they are ACE survivors, when they've had adversity in childhood, is I'll ask them to imagine themselves as a butterfly on the wall of their childhood home. And what they're doing is they are watching a child they care about, either their own child or some other child to whom they're connected, trying to cope with that childhood home. And they have to watch that kid try to deal with whatever it was the patient had to deal with for a week or so. And how would the patient feel watching that happen? Because many of my patients, when they think about their own experience, they're minimizing how
Yeah.
much they had to cope with. But when they think about their own kid having to deal with the same stuff, their facial expression often changes dramatically.
And it engenders self-compassion, which I think is an element missing from a lot of people's personalities, is the ability to step outside of themselves and, not be continuously critical of themselves for being weak, vulnerable, etc.
That's one of the very common long-term personality traits that are generated by an ACEs experience. Absolutely.
I just want to ask you, you were, you had conventional training and, went on beyond just basic training in internal medicine to gastroenterology, presumably had a successful career as a gastroenterologist. Did some of your professional colleagues kind of dismiss this a little bit as, maybe Dave's going off the deep end a little bit here? He's abandoning, successful practice of gastroenterology to go into this kind of woo-woo area.
It's an interesting question. I worked for a large HMO for a number of years, and in my early career, when I was still learning how to do this, it took me 4 or 5 years to sort of climb the learning curve of getting reasonably competent at this. But as soon as I felt like, I'm getting really good results on a consistent basis here, I got the Doctor of the Year award from my colleagues in this very large HMO at age 37, which, it was an award that was usually given to a much more senior physician. And that was a surprise.
That's
and
very validating.
After that, people started sending me patients who didn't have gastrointestinal problems. They would send me these mystery patients, gentlemen with unexplained back pain for 25 plus years, another gentleman with total body itching for 3 years, all kinds of unusual stuff. There was a gynecologist who sent me patients with pelvic pain. that had negative diagnostic evaluations, and he would schedule those patients for a laparoscopy the week after their appointment with me, so that it would be, he'd be ready to do the laparoscopy if I didn't find anything psychophysiologic going on. And I don't think a single one of those patients that this particular GYN doctor sent ever got their laparoscopy, because every single one of them had a psychophysiologic cause for their pelvic pain.
So you became a kind of a doctor of last resort for some of these physicians who are grateful to you that you took care of their very dead-end patients.
Yeah, I mean, there was some administrators who thought, why are you doing this? You don't even have a psychology credential.
Yeah. Mm-hmm.
But the results were so good that, there was another administrator who said, I'm going to give you 45-minute appointments for these patients because your results are so good.
Right. Can't do it in 10 minutes.
You deserve to have this time. Yeah, absolutely.
Yeah. How do you find a qualified practitioner? Because, I embrace these ideas. I'm very receptive to this, but I'm not sure I'm qualified to, administer the kind of deep and comprehensive process that's required to unravel some of these patients. How do you find someone who like yourself? I mean, you're not a one-off. You actually head up an organization of like-minded physicians. How do you find someone who is qualified?
Yeah, we have a directory on the endchronicpain.org website of clinicians, mostly mental health professionals, but there are some MDs on there as well who have embraced this approach. But I think for most of the clinicians out there, if you're not feeling like you're 100% able to do this with patients, you don't have to do the full diagnostic and treatment process. If you can just rule out the biomedical process that's going on, ask a few questions about stress in the person's life at the moment, ask them about stress when they were growing up, make sure they don't have depression, anxiety, or PTSD. And then, if you're feeling like you've got enough evidence to point the patient in this direction, there are today, which I dearly wish I had had available when I first started, but there are today lots of resources for people. There are self-help books that are evidence-based that
and you wrote one, by the way,
on our
which
website.
Is They Can't Find Anything Wrong. It's called They Can't Find Anything Wrong, and that's still available.
Absolutely. Yeah, it's selling more copies than ever, in fact. But there are, I have, if that particular book doesn't work for a particular patient, there are a number of others that take complementary approaches that can work for a patient if mine does not. There is an app called Curable, which is based on all of the concepts we've been talking about today. The creators of that app interviewed me and at least a dozen of my colleagues to get all our best ideas and put them into this wonderful user interface. We have recorded conferences on the website. We've got 2 webinar-based courses, including one that just released last week, that are jargon-free, so that even people who are not professionals can benefit from those. Lots and lots of ways that people can help themselves. It's only a small fraction that actually need a PPD-trained psychotherapist to get through this.
Wow. Okay, so lots of resources available at endchronicpain.org, and a timely reminder is that, and I actually didn't realize this because I, just scheduled this podcast, but then I saw on endchronicpain.org that you're offering a free webinar that's going to drop in the evening of February 1st.
Yeah.
Right. That's, I guess, this Thursday, I believe. Okay.
Yes. And again, that's going to be 2:00 Pacific, 5:00 Eastern. It's going to be for an hour. We're going to have people able to ask questions of me, and possibly some of my colleagues are going to drop in there as well, so that people can get their own questions answered. And it's 100% free.
I'm sure that'll gain a lot of traction among our intelligent medicine listeners, because they're likely to either suffer from pain syndrome or know someone who is likely to benefit from this type of approach. So great stuff. Dr. David Clarke, I want to thank you very much for joining us, and I really want to applaud your innovative approach that I think is going to bring relief to a lot of people. It's high time that we recognize the important role that psychophysiologic disorders, PPDs, have on the vast landscape of pain syndromes that Americans, people across the world experience. So great stuff. Really appreciate it.
Thank you, Ron. I really appreciate your interest in spreading the word.
My pleasure. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. There were many important reasons why I started my FullScript online supplement dispensary. I wanted to offer you the same curated professional-grade supplement brands that I use, the ones I know and trust. I also wanted to ensure that they weren't counterfeit or expired. Recently, I've been hearing more and more about counterfeit or expired products purchased from online retailers. With FullScript, you can be confident your supplements are genuine and they'll arrive with optimal freshness and potency. Also, buying through FullScript offers fast, free shipping, optional refill reminders, and a highly rated mobile app. It's safe, secure, HIPAA compliant, and offers world-class support. Go to drhoffmanstore.com for more information and to start your free FullScript account. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs: heart health, immune support, and much more. To get started, just go to drhoffmanstore.com, drhoffmanstore.com.